Welcome to this explainer from our medical education team right here at Westminster Multispecialty Clinic in Dubai, Healthcare City. Today, we're going to unpack a clinical reality that, let's be honest, a lot of us try to completely ignore. We're talking about why orthopedic issues rarely, if ever, just resolve on their own. We've all been there, right? Hoping that if we just give that ache or twinge enough time, it's just going to magically disappear. But as we're about to see, that wait-and-see approach almost always does more harm than good.
Here is our clinical roadmap for today. We'll be walking through the deception of intermittent pain, the biology of delay, the psychology of waiting, a really crucial 2-week clinical window, and finally, the truth about early assessment. So, why exactly do we ignore pain? It's a question we get constantly at Westminster Multispecialty Clinic. Why do so many of us just brush off a tweak on the pedal court or a nagging knee after a long day walking around Dubai Mall? Looking back, it always seems so obvious, like if it was going to get better on its own, it definitely would have by now, but we stubbornly ignore it anyway. Well, it turns out our bodies are actually playing tricks on us. Let's dive right into section 1, the deception of intermittent pain, and when our biology tricks us. The biggest trap we fall into is totally misunderstanding what intermittent pain actually means. When your lower back sees up on the drive to work but feels totally fine by mid-morning, you probably think, oh, it's nothing. But here's the kicker. Pain that comes and goes is absolutely not a sign of recovery. It's a highly deceptive cycle. What's actually happening is your underlying structures are being loaded, irritated, and then unloaded again. You aren't healing at all. You're just stuck in a cycle where your capacity to heal is slowly diminishing with every single irritation. Just look at what happens with tendons over time. What starts out as reactive tendinopathy, which is this really early, highly treatable stage where we just use simple load management and guided exercise, can easily spiral out of control. If you ignore that pattern of intermittent irritation, it literally grinds down into degenerative tendinopathy. It becomes this stubborn, advanced condition that is so much harder to treat. The treatment options for these two stages are just night and day. Moving on to section 2, the biology of delay and how these injuries spread. You see, orthopedic conditions do not just sit still in isolation. They adapt, and those adaptations make your treatment way more complex. Research in the American Journal of Sports Medicine completely backs this up. A single unchecked issue, like an initial ACL tear, creates knee instability. That instability then forces your medial meniscus to act as a secondary restraint, totally overcompensating for the torn ligament. Fast forward a bit, and that unnatural load causes secondary cartilage damage. What started as one isolated problem has literally just turned into 3. At Westminster Multispecialty Clinic, we see this exact cascade effect all the time, especially with early joint pain and hip arthritis. When your hip hurts, you naturally and unconsciously shift your weight to avoid the pain. Well, that altered gait unevenly loads your opposite hip. It puts unnatural stress straight onto your lower back, and it completely changes the mechanics of your knee on the affected side. Delaying care spreads the injury like wildfire. By the time you finally come in for that original hip, we're usually treating secondary problems in your back and knees too. Okay, section 3, the psychology of waiting and what we call the silent bargain. We see this every single day, and honestly, we completely get it. For active professionals here in Dubai, people playing sports, hitting the gym, juggling busy social lives, acknowledging a joint problem carries this terrifying implication that you have to just stop everything. You worry that stepping into a clinic means immediate surgery or months of agonizing recovery. So you make a quiet deal with yourself. You decide to just train around the problem, popping anti-inflammatories before a game, icing it afterward, doing everything except actually treating the root cause. This quote right here hits the nail on the head. The adaptation becomes normal, and normal becomes the baseline until the original pain level that once prompted concern now seems like a good day. Listen, we want to reassure you that this is not a failure of judgment on your part. It is a deeply human, totally normal response to non-urgent pain. But realizing that your baseline is shifting is usually what finally breaks the cycle. You have to recognize that your normal has actually just degraded. So let's talk about timelines in section 4, the 2-week clinical window and the actual price of waiting. A massive 2024 analysis published in the journal Musculoskeletal Care dug into exactly 15,624 patient records. They wanted to track recovery trajectories and see what actually moves the needle when it comes to getting patients out of pain. That is a huge, incredibly reliable data set. And the clinical gap they uncovered? It is undeniable. Patients who were treated within the first 2 weeks of noticing symptoms are twice as likely to achieve favorable pain outcomes. Intervening within that really short 2-week window literally doubles your chances of a fantastic recovery compared to those who just wait it out. The difference isn't small, it is massive across a whole range of conditions. Yet, most of us spend way longer than 2 weeks just debating if an ache is even worth getting looked at.
Because we wait, we end up seeing this exact timeline play out constantly. The back and spine cases our specialists handle usually follow this exact trajectory. Months or even years ago, it was just intermittent symptoms you managed with some rest. Then, in the recent past, there was a trigger, a heavy lift at the gym, an awkward twist, maybe a long-haul flight, and then boom, present day. It culminates in a sudden, undeniable, acute pain episode. But here is the hard truth. That acute episode, it isn't a new injury. It's just the exact moment an established, slowly worsening problem became completely impossible to ignore.
Which brings us to our final section, Section 5, the truth about early assessment and busting that surgery myth.
An early orthopedic assessment at Westminster Multispecialty Clinic rarely ever means immediate surgery. Actually, it's quite the opposite. Getting in early opens the door to highly effective, non-surgical, conservative management options. We're talking about a whole arsenal of premium tools here: targeted physiotherapy, strategic load modification to protect your joint while it genuinely heals, guided exercise protocols, and highly precise image-guided injections. These are incredibly powerful interventions, but they absolutely work best when we catch the condition early. Coming in for an early consultation gives our team a clear, comprehensive picture of what's happening, so we can build a proactive roadmap. The reality we see in our practice every day is that surgery becomes necessary far more often when these early intervention windows have totally passed us by. The patients who end up needing the really significant invasive treatments, they're almost always the ones who waited. Meaning an early visit, right at the onset of that intermittent pain, is literally your best defense against the operating room. So, we want to leave you with this final thought as you think about your own habits. Are you just waiting around for an undeniable acute episode? Are you going to wait until the pain completely stops your life? Or are you ready for a structured, preventative plan? Please, don't let your biology trick you, and don't let the fear of stopping force you into a much worse outcome down the road. Book an assessment with our expert team at Westminster Multispecialty Clinic while your treatment options are still broad, conservative, and highly effective. Thanks so much for joining us for this explainer, and we can't wait to help you stay active and pain-free.